Chris, it is Breast Cancer Awareness Week here on the Hampton Roadshow, and we want to keep you educated about women's health issues. And when you think of breast cancer, you may not think about bone health, but you really should. We have two guests to tell you why this morning. We're joined by Dr. Wayne Kaiser. He's one of the nation's leading oncologists, and also Linda House. She's the Executive Director of St. Vincent's Care Center in Indianapolis. Thank you so much to both of you for being here with us today. And that breast cancer diagnosis, it's all-consuming. You're planning your treatment. Why should women, though, make sure that they don't leave their bone health out of the equation?
Well, Carrie, I think the main reason is because both the treatment and the disease can affect women's bones. In early disease, we often use hormonal therapies to suppress the return of breast cancer. The treatment itself can cause bone loss, and this can predispose a woman to fracture from the disease treatment. When the disease is advanced, up to 75% of women will have breast cancer spread to their bones. This can cause pain, fracture, the need for radiotherapy or surgery, and if spread to the spine, can cause spinal cord injury.
Is this something that when women are diagnosed with breast cancer, that they can immediately start with the strengthening exercises, the calcium supplements, or is the message here today that women should be taking care of their bones all the time, so that if something like a breast cancer happens, they're just better off?
Well, I think both issues. Women should be taking care of their bones all the time. Calcium, vitamin D, as you've mentioned, the weight-bearing exercise, that's very important. And then when a woman unfortunately develops a breast cancer, that becomes even more important. Then to discuss those issues with her physician is an extremely important issue. And there are good sources, resources, tools to know about that.
Let's talk about some of those
Carrie,
resources.
the thing that I would add to that, is part of the message here today is for women to be proactive in those conversations, to make sure if you're a woman with breast cancer or if you're a care partner of a woman with breast cancer, that you be proactive in educating yourself and being active in that dialogue with your healthcare team. Don't wait for the healthcare team to bring that up with you.
One other question that I wanted to ask is does the treatment of cancer, it can lead to frailty in the bones, but does that have anything to do with the likelihood that the cancer will spread to the bones, or is that a totally independent event?
That's an independent event. The frailty of bones can occur as a woman ages, and that can be treated and should be discussed with her physician. The frailty that is increased with breast cancer in bones, or the treatment, is another whole issue, and I think it's important for a woman, again, to discuss that with her healthcare provider, and there's a good resource for that called bonehealthinfocus.com, which gives information, tools, and resource for a woman to be able to discuss that with her physician.
All right. We'll go ahead and put that link on our website. When folks visit thehamptonroadshow.com, we'll send them right over to Bone Health in Focus as well. Thanks to both of you for making time for us today.